Hello everyone, welcome to session 2 of the Weekly MMI 2016. Before we begin, as usual, can everyone hear me? Perfect, and you can all see the screen? Great, let's get started. Okay, so the plan for today, we're covering topic 3 only, we're not combining any topics today. And topic 3 is about this professionalism skill, and we're going to be going over 6 cases that I've prepared, plus any questions you have, any quick cases you might have. And just to prepare you from the start, we have 6 cases. We have 10 people here. Actually, now 11. We'll see if a few more show up. But I'd like you to, or if you want to, volunteer to do these practice cases later on with me in the one-on-one later in the session. And if we have time, we can do the same case twice to see how different people would answer differently. All right, so let's get into professional. So this is what I'm assessed on, what the definition of professional is on my assessments. So as you'll see, when we go through the stations, it will be touching on every one of these things. So a professional is a physician who demonstrates integrity and honesty, is sensitive, ethical, self-disciplined, communicates with compassion and empathy, which sort of goes with sensitive, knows their own boundaries, and recognizes when to ask for help or advice. And that's a big one. So if you keep these things in mind, when you're going into a station, you say, okay, I want to show that I'm ethical. I want to show that I'm compassionate. I want to show that I know how to ask for help. And if you have these things in the back of your mind all the time, then you'll be more prone to actually doing them. So if you're in a station where you don't know the answer, you know that part of being a professional is knowing when to ask for help. So you'll say, in this certain scenario, I'm not entirely sure about the data being presented here, as I'm not an expert in this field. And although I'll be happy to give you an opinion on this data today, based on my knowledge, I would be more inclined to consult with someone who is an expert in the matter to be able to provide you with the best answer. Okay, and that's someone who knows how to ask for help and someone who's confidently asking for help, versus someone who says, I don't know anything. Yeah, I haven't really studied this and I don't remember it. And no, I don't know what to do. I don't know what to do. Yeah, we should probably ask someone for help because I'm not sure what to do. You see the difference? So who would you accept to medical school, right? Practice in front of the mirror. All right, please enter room now.
Good evening.
Hello?
My name is and I'm here to discuss with you the issue of physician suicide. So I've been given the case where in the US the rate of suicide amongst physicians is evaluated around roughly 2 to 4% higher than the general population. And I've been asked to discuss the factors and what can help to resolve the issue.
Exactly, please go ahead.
So I think the factors that might contribute to the differential between the general population and the physician might be the high level of stress to which those physicians might be exposed. Also being a higher level of education and higher position maybe in the society, they might be exposed to more stress, so leading to a higher level of suicide. Another aspect I've been thinking is maybe the lack of support that the physician might be experiencing. Something to help solve the issue, I think before trying to help solve the issue, I would deep dive in the data that is given to me, because I'm just given two numbers. One is the general population, one is the physician, and I have no idea what is the age spread or the gender spread or the geographic location spread. So I would like to look at that, like, is it in big cities, small cities, rural, urban areas? Is it more male, elder, and so on? So really to be able to help solve the issue and pinpoint exactly where the problem is, I would like to look at and mine the data. But if I can give some guidelines to help solve this issue, I would assess the current support network that is offered to physicians, and to know and understand what is the help offered to them. So I can understand if help is offered and they're still showing a high rate of suicide, there might be a discrepancy in the communication, or they're not willing to go toward help. Do they have the right to counsel patients if they are themselves depressed? That's a double-edged sword, I think. Of course, knowing, experiencing yourself a disease give you more insight to the disease itself than learning it in the books. So that's precious experiential information that can really help the physician. On the other hand, M5, the latest.
End of scenario. Please exit room now.
Thank you very much. Have a nice day.
Thank you. So very good, very good. Yeah. So I tried to stress you out a little because it's possible that they'll do this too, okay? You have very good answers, you had very good answers, and you get to the 4-minute mark, and then they start to, try to push you around because they have time to waste, okay? So they also want to see how professional you are, how you maintain yourself, and you did very, very well, okay? Just a few things I wanted to tell you. Number one, I loved your speed of talking. Okay, you spoke in a very calm way, and this allows you to slow down and think ahead. Okay, because when we get stressed, we love to start rambling on and talking very fast, and it's hard for us to think about the next sentence when we're getting there in just a second. But if you speak slower, it gives your mind time to digest. So very good that you have very good technique with that. Okay. The other thing I wanted to commend you on is that you commented on the data. Okay, some people will just look at this and say, oh yeah, the rate is 2 to 2.8 or whatever, 2 to 4 times higher, and they'll forget that this is based on different statistics, where did the statistics come from, what age group. Absolutely, that was a huge thing. Okay, and Alex even said that the smaller sample size for the physician population might affect the data. Well, that's true, but maybe the data was graded based on it, and it is actually known that the physician rate is higher, unfortunately.